My goal today is really to dive into the product as fast as possible. Just before we do, we've been a partner with TELUS for several years now, and we've built and scaled our products along with TELUS across Canada. It's been a very wonderful journey so far, and where we're at PetalMD, well, we have more than 40,000 physicians using our products across 200 healthcare institutions, and we're also expanding our solutions outside of Canada. And so we're now looking into expanding our products in Belgium, France, and elsewhere in Europe. Our Petal Booking solution is really what we're going to focus on today. Our solution is basically a web portal giving full control for patients to manage their appointments, to book their appointment, and cancel their appointment. Of course, there are many, many features, and we're going to dive into the configuration of all the settings, all the services that can be put on the website and consumed by patients. We also offer a powerful reminder system, and all the information that is modified or input by patients into our portal is seamlessly integrated into EMRs. So you can see that we're integrated with most of TELUS EMRs, and we're looking at expanding our portfolio of integration over the next months. So our patient portal is really a key solution for patients to engage with a website experience, to manage, as I said, their appointments, and also receive reminders. They can also configure their reminders on how they want to be reached, confirm, cancel, or also input more information. So the clinic can at any time reach out to their patients by email, sticker SMS, or by automated phone calls, and give more information to the patients regarding appointments. We've embedded many analytic dashboards in our products. This helps medical clinics and also some hospitals to analyze the load of requests sent by patients. So if, for example, in January, during the flu season, the medical clinic uses the dashboards and can analyze that there's on Mondays and Tuesdays, it's usually the overloaded time of the week where patients will come in for a walk-in appointment or a last-minute checkup. So we can use dashboards for a bunch of analysis and then redistribute the appointments offered on the web. One thing we do with our patient portal is that we integrate with your existing websites. So for the medical clinics that already have a website, you do not have to create a separate website. And we simply add a button that guides the users and patients to book their appointment from your existing website. We also offer a completed hosted website for those clinics that do not have an existing website. The reminders that we're going to look at in the demo is the possibility to configure reminders in multiple languages and also define the slots where reminders should be sent. So, for example, for pregnancy follow-ups, you might want to send a reminder a week ahead of time or 24 hours before an appointment. So this is all configurable at the service level, and is also available to be configured per provider. So Dr. A might have preferences on when reminders for his or her patients should be sent, and Dr. B could have different preferences. The whole appointment system is flexible and configurable. As I said, the Analytics dashboard gives an overview of the allocation of appointments across the clinic. This helps the clinics distribute appointments across the multiple providers and also add more staff if needed and respond in advance to peak demand. So far, with our booking solution that's been in production for more than 4 years, we've reached over 1.8 million patients, and we've sent over 500,000 appointments. These are all appointments that have reduced dramatically the no-shows at the medical clinics that we work with. and also increase the patient satisfaction by offering appointments online. So in the demo that we're going to see in a few seconds, we're going to cover a few, two things mainly. So we're going to configure the reminders, the service types that are going to be available for patients. We're also going to look at the patient portal, so the overall user experience for users that will access the portal from a website. And we're going to do an example of a patient booking an appointment for themselves or for a family member. So I'm going to go ahead and jump into our product. But before I do so, I'm going to give you the example of Clinique Medicale Saint-Louis. That's a client of ours in Quebec. They're using Kinlogics. And all they did on their existing website was add a huge button here that says Medical Clinic, book an appointment. So by clicking on this button, this brings the user or patient directly to an authentication mechanism and will give them the ability to manage their appointments, book an appointment, or cancel an appointment. So of course, this is a real client. I'm not going to go into this portal. I'm going to switch to a demo portal for the demo here. So to your left, my screen currently is separated in two. To the left, what we have is the actual patient portal. So just like I showed you from the Medical Clinique Saint-Louis, here, this is the usual place where patients will log in. They need to create secret passwords, and we'll use their email as a notification mechanism. Patients that do not have an account, they can create an account, and when they do so, we will validate that they're an actual patient from the clinic by validating the information with the EMR. For clinics that are accepting new patients, new patient profiles will be created in the EMR and will be reviewed by the staff if needed. So in this case, I'm simply going to log in into the patient portal. So as you can see, the patient portal remains very simple. We've worked with the patients across medical clinics to create a very simple experience. Most of the time, 80–85% of the time, patients will come in and consume the patient portal to book an appointment. So we did put the initial buttons at the top where you can either book an appointment with their primary care practitioner, or they can book also other services. So many medical clinics offer more than one type of appointment, and it's something that's available within the configuration platform. Here at the top, you'll see that I'm currently logged in as Emily Bourgeois, but I'm logged in as Emily Frappier. And my roster doctor is Patricia Sauvageau. I can also look at my other family members. So we have a delegation mechanism that allows the user to add family members in their profile. So for moms and dads, they can add their children to the profile and then book appointments on behalf of their children. So here, if I go back to my list, I can see that in my appointments here, I don't have any appointment pending. So I can go ahead and ask for an appointment. We have a mechanism of recall. So for patients that need to be seen by a care provider every 3 weeks, every 3 months, we have a mechanism to automatically remind the patient that it's time now for a checkup, so they are a follow-up. So a notification will be sent to the patient, and then they'll be asked to book an appointment. For example, here we have tests, which is not a valid example. So there's a test, there's a blood sample that needs to be taken with Dr. Ellen. I could go ahead and just book an appointment. The patient always has access to their patient appointment history. So they have very basic information on their previous appointments. So before I go ahead and book an appointment, I'm going to show you what I can manage in my profile. So here, the first thing I see is my profile and people linked to my account. So I can go ahead and add more children if I need, or more relatives if also needed. So of course, we enforce that the user has access to, has the right to add this person. The other user, so if I were to add a family member for which I don't have their approval, then the other person's profile would show up, would be notified by this notification, and they could always unlink from their account. So to the left, patients can manage their personal information here, and we do a cross-synchronization with the EMR. So you no longer have to have someone at the reception within a clinic that will validate the personal information of your patient. So whenever here, if I were to change my address or phone number at the bottom, this information gets translated back to the EMR. The patient can manage their appointments. So for example, here, if I configure it for myself, I can define that I'd like to receive new notifications anytime my primary care practitioner publishes new availabilities online. For example, if Dr. Anderson opens new appointments availabilities every 3 weeks or every month, then I can say, well, whenever in the month of April or May, whenever new availabilities will be published by Dr. Anderson, I'd like to be notified because I know I need an appointment for an annual checkup. For all types of appointments, patients can define which way they prefer to be reached. For example, here I can say I want to be reached by email, I can prefer SMS, or automated phone calls. The automated phone call is basically a robot with a nice voice that will remind the user that they have an upcoming appointment. The content of the message is very limited, so we don't want to give out sensitive information when reminding patients that they have an upcoming appointment. We always get the patients come back on a portal and confirm their appointment or cancel their appointment if needed. So again, we can reach patients by email, SMS, and automated phone calls. SMS have the advantage of enabling the patients to confirm their appointment by pressing 1 or canceling their appointment by clicking 2. The automated phone calls have something similar. So basically, when we call out patients, they can confirm their appointments by pressing 1 or they can cancel by pressing 2. Any cancellation, if configured properly, will notify the staff of the clinic, and then they can go ahead and reallocate the appointment to another patient. So this portal is available on both mobile and on the web. We do what we call in software development a responsive version of the application. So if I were to reduce the size of my screen, you'll see that everything aligns and has a mobile look. Now I'm going to move to the right section of my screen. This section is meant to be used by the staff, the clinic staff. So at first, let me say that PetalMD is a platform that has several products. So the icon that's selected and highlighted here is our booking solution. For larger clinics, we also offer physician scheduling. So if there's a need to allocate offices across the clinic for more than 10, 15 physicians, it's possible to use our physician scheduling or healthcare professional scheduling and make sure that each physician works the same amount and is allocated the same amount of office time. We also have secure messaging. So we're slowly we're expanding our messaging to enable patient to physician texting. And we know that this is a very sensitive topic. So what we're rolling out is actually a one-way messaging so that physician and healthcare professional can send out messages that will appear on the patient portal. But we do not want to open the door where patients can request information and text any care provider on PetalMD. So if I'm back to my booking solution here, what we see first is the fact that, well, we're landing in the analytics section. So this helps the staff and the clinic and physicians analyze how appointments are allocated throughout the clinic, and they can also see how many appointments are distributed. So you can see where, if you can follow my mouse, you can see that the distribution per source is very interesting. And the way that the appointments can be configured to be available on the web or reserved for the clinic only. So the way this is configured is basically by going to the clinic settings. And of course, the configuration here, we're not going to show the EMR, but you can assume that this is all synchronized back and forth with the EMR. There's basic information on the clinic, so you can see that the logo here, Clinique Medicale Saint-Louis, is the same that matches on the web portal, same with the address. So this is all on the patient-facing information about the clinic. And I can go ahead. The first thing, of course, is to configure staff. This is also synchronized with the EMR. So for any TELUS EMR that you might use in your clinic, you do not need to configure the staff section. This is all imported from the EMR. Same goes with the patients. So the patients will also be integrated with the EMR. Previously, I mentioned something if you still toggle. So the fact that you can accept or not new external patients. So again, this is a way to simply configure the patient portal and make it available only to your patients or to a broader audience. Now, if I'm looking at the services section, this is where we define which care provider is offering what type of services, and are these services available on the web, or are these services that need to be booked by the staff only? For example, I'm going to look at the pregnancy follow-up here, so I'm going to go on Edit. And we can see the basic configuration of this service. So here, of course, there's a name, the default reminders that will be sent for pregnancy follow-ups. So I can say here, the default value is not something I'd like. I'd like 24-hour reminders for the first one. And also, I'd like to notify my patients 1 hour before the appointment to make sure that I don't have last-minute cancellations. We can also define restrictions of which kind of patient can book this type of appointments. So in the case of pregnancy follow-ups, we're probably going to be scoping out mails from this type of appointments. This means that pregnancy follow-ups will not be visible on the portal or in an email. So here you can see that I have a restriction that says only female patients can book this appointment. And I'm also going to scope out probably a younger audience. So next here, I can say that I'd like to have automatic publications. We know that Dr. Santerre probably would like to have their pregnancy follow-up appointments published every 14 days. And that she usually starts seeing patients at 8 a.m. So that means that there's no interaction that needs involved by the staff or by the physician themselves. Appointments will be published automatically. We also offer the ability to add attachment. So whenever, for pregnancy follow-up, for example, if there's a form that needs to be filled before that type of appointment, it's as simple as adding a new attachment. And when the patient is given the appointment, the form will be attached to this appointment. They can either print it or fill it online. We've also run into the case where many clinics had a high load of last-minute cancellation. And we don't want patients to go to the portal and cancel appointments maybe 1 or 2 hours before their actual appointment. So we can put in a restriction here. It says, well, you know what, 2 hours before appointment, you can no longer cancel the appointment online. You'll have to call in the clinic and justify your absence for this appointment. So I can go ahead and enforce a 2-hour limit for this appointment. Now, if I were to configure the pregnancy like I just did, so that means that all physicians offering pregnancy follow-ups would only be seeing female genders. But let's say, well, I have a physician in my group or in my clinic that has very specific, very specific restrictions. Well, I can toggle Dr. Santerre and say, well, you know what, for this particular physician or healthcare professional, well, she's only seeing a very, very specific patients that are 21 and 22 years old. So for every care providers that are tied to this type of service, I can configure at a very, very granular level their preferences. So now I'm going to jump into the reminder section. So the last configuration here, this is very, very important to reduce the no-shows. And we've had a lot of success with the clinics we work with to achieve a tremendous reduction of no-shows. So just like I did with this service, well, I can also configure generic reminders. Say, well, for the default value for our clinic is to send out 72-hour appointment reminders and also 2-hour appointment reminders. There can be generic messages in French and English and other languages if needed that can be sent along with the reminders. We also offer an acceptable hours for sending reminders. So we don't, if a patient has an appointment at 8 a.m., well, we don't want to be sending out SMS or automated phone calls during the night. So if, for example, the clinic has set a 3-hour before appointment reminder and the appointment is at 8 a.m., that means they would get a phone call or an SMS at 5 a.m. So to achieve acceptable hours, well, we're going to say that before 7:30 in the morning, for example, we're not going to be sending out reminders. Again, if the clinic has general documentation that needs to be joined in along with reminders, we can attach documents here, forms that can be filled by patients before their appointment. So to summarize the section, configure the clinic is one operation that needs to be done when getting going, and then appointments, types, and reminders can be tweaked as the clinic evolves by using the product. I'm going to go now and jump into the appointment section. So I'm going to look at our healthcare professional in our clinic. We have a bunch of physicians, nurses that are offering services. For example, here, I'm going to jump on Patricia Sauvageau. So I can configure this physician's list of services. Each care provider can have particular particular distribution of time. So for example, I am expanding 2 templates here. So Dr. Sauvageau, she usually comes in on the Monday and does from 8 to 12, she usually does regular exam. Same on Tuesday, but her hours are from 8 to 5. So here what we're doing for each care provider, we're trying to build some templates that will be the default templates used when creating availabilities and appointment availabilities online. Again, these templates are meant to be created in order to save time, but at any time, the clinic can manually add appointments within the physician's calendar. So again, here this is a very basic template of the distribution of time, and we know that from week to week it might change, but it helps and really accelerates the fact that we need to configure 15-minute appointments, for example, from 8 to 5 on Wednesdays. Now, for Dr. Sauvageau, right now, if we were to say, okay, well, Dr. Sauvageau's template, we want to automatically publish availabilities online, then here we'd say from January 30th till, for example, February 16th, we can go ahead and just publish availabilities online. So that means the templates that we've seen previously are being used to create 15, 30-minute appointment slots that are either available on the web or available for the staff only in the clinic. So I've just clicked on our schedule, and we can see that a bunch of appointment availabilities have been created within Dr. Sauvageau's calendar. For example, on January 31st, we see that there are periodic exams from 8 to 8:45, and I think it goes until 11:45. So at any time, this interface can be used by the staff or the physician to manually book an appointment with a patient. So if I'm trying here, got a patient, call. I'm going to go here. I select the patient that needs to be seen by Dr. Sauvageau on the 31st. I can add notes on the appointment. And again, all this information is synchronized back and forth in the EMR. So in the case where the appointment is given from with the EMR's interface, it will be synchronized back to Petal. Schedule. I'm going to go ahead and save this appointment for a patient. So we see that this availability is no longer available to be booked by someone else. As soon as a user clicks on a cell here, this appointment is no longer made available elsewhere in the clinic. So we've built something we call the ticket master of appointments. That means that whenever the appointment is offered to a patient or presented to the staff, no one else can book this appointment. We also have the case where families might come in and they'd like to have 3 consecutive appointments. Well, the clinic can go ahead and the staff can go ahead and reserve this availability. So here I've reserved 1. I'm going to reserve another availability and make sure that these are no longer available on the web. So you might be asking yourself, okay, but what if I do not want to put all these appointments on the web? That's usually the case when we roll out our software in a medical clinic. We gradually add more and more appointments to the web, but we understand the reality of change management within the clinic, and we usually roll out a 10% offer on the web. And as the confidence grows with the portal and the usage of the software, our clinics and what we've seen from care providers and clinics is they usually grow from 10% on the web up to 85% on the web. So we really remove the burden of appointment management within the clinic and by the staff, and we offer a better experience and a self-service experience to patients. So as I said, the little mouse icon here, that means that this appointment is available on the web. In the case of Dr. Salvaggio, she's really open and she's really using software, I should say, at its full potential. So she's exposing all of her availabilities on the web. But again, you can restrict the amount of appointments that you want offered on the web. And we see this a lot where there are some patients that do prefer to call in the clinic and book their appointments by phone. So now if I go back to my patient portal to the left, my patient here, Emily, she's actually a patient of Dr. Salvaggio. So I'm going to go ahead and ask to book an appointment with my care provider. So I'm going to ask for a periodic exam, for example. And as soon as I click, of course, I'm offered also if I'd like to book appointments for one of my relatives that are linked to my account. So if you remember right here, I have another, I've called my sibling Emily also, but I can go ahead and book for both at the same time. I can also say, well, I'd like not to be able to have both appointments with a maximum of 15 minutes apart. For the scenario here, I'm just going to say, well, I just want to book an appointment for myself. And then the patient gets to select which moment of the day and which day they'd like to book this appointment for. So here, I'm offered January 30th at 1:45. So that's actually very soon. If I go back to the clinic, I can see that the layout here, I'm going to try and make more space so it's more visible. So I can see here that the background has changed. So that means that if I click on it, I can see that there's a little activity going on with this availability. So there's a patient currently looking at it, and I cannot book this appointment. So the staff is currently blocked from giving out this appointment. And other patients are not presented with the same availability. So there's no way that this appointment will be double booked. Now back to the portal, Emily has to decide if she wants to take this appointment within a 2 or 3 minutes delay. This is also configurable by clinic. And if it doesn't suit my need, well, I can go ahead and ask for another suggestion. So here I'm offered an appointment at 2 p.m. And I can see that the little background here has changed. So I'm going to go ahead and try to move it again and again. And so in real time, you can see that the background changes, and you can also follow the flow of the patient. So if that's fine with me, at 2:30, I can book my appointment. It's as simple as that. The appointment is confirmed within the clinic and synchronized with the EMR. So here, as you can see, if I click here in the clinic, Emily has been booked for a periodic exam. And if there were some more information on the appointment, well, it would be shown here. So back to the portal, if Emily goes and logs out and logs back into her portal, she'll notice that the appointment is here, is listed here as an upcoming appointment, and that also she cannot book a second appointment with her care provider because there's already one in queue. So again, this is all configurable. You can say, well, a patient that has a periodic exam, for example, cannot book a second periodic exam, but they might be able to book other services such as lab tests or anything you see here. So the clinic here, the demo clinic I'm using, as you see, has many other services. So I could probably say, well, okay, I'd like a physiotherapy follow-up. And here, as you can see, there are some details that need to be filled in by the patient. And the Hertz If I have referral, I could also put it there. My knee. Unfortunately, there's no physiotherapist working here. Okay, so now that I have my appointment, which is actually today, I can go ahead and confirm my presence. So as you see, there's no cancel button. That's back to my configuration I've shown previously that says, well, a patient cannot cancel an appointment more than a few hours before it occurs. But the patient can confirm their presence. So if they haven't done so with the SMS reminder or by the automated phone reminder, they can go ahead and confirm their presence. So what that does is it gives the clinic an overview of this patient status. So here, there's a button that says the patient has confirmed their appointment. Later on, if the patient does not shows up late or does not show up, the staff can go here and say, well, the patient didn't show up. So this status is synchronized back with the EMR, and if you have patients that have a back record of not showing up to appointments, you can take action on this issue. So if I resume what we've seen so far, we've seen the patient portal to the left that allows a very flexible way of booking appointments, managing the upcoming appointments, confirming our presence, linking my relatives in my profile so I can book appointments for them. And we've seen the configuration section of the patient booking product. We've seen the configuration allows flexibility of offering multiple services online and reserve some services to be booked only or appointments booked by the staff. And as I said before, every piece of information that's synchronized here with the EMR. So that covers the demo of our booking solution. And we're going to open up the Q&A, and I'm going to ask Allison to please guide us through this.
So thank you for that very informative session, Francis. And just a note, we did have several questions come through the chat. Due to time, we may not get to all of your questions in the next 13 minutes. So we will do our best, but if we don't get to them, please reach out to a telehealth expert who will happily answer any questions that you may have in case you don't get to those questions today. So the first question was, if somebody works in a multiple physician office, do all of the clinic's physicians need to join PetalMD or Petal Booking?
Very good question. No, actually, you do not have to have all physicians configure to offer appointments on the web. What happens, though, is it could create some frustration from patients if they're discovering that one physician or one care provider is offering online availabilities, but the other not. But definitely, you can configure which care provider uses the booking product.
And kind of along those same lines, can patients without a family physician at a clinic book an appointment online?
Yes. Yeah. In the configuration of services and care providers, you can define if the type of service is available for any care provider or if it's only for rostered patients.
Okay. Several questions came through about the implementation process. So what happens once the clinic is ready to go live with Petal Booking?
Great. So we do have implementation specialists. The first step we do is synchronize both the EMR and our booking solution. We offer remote or on-site training. So we do offer training for usually the clinic director that's overseeing all the appointment location and overall patient experience. We usually start with a very global demo for the staff, and we go through all the steps of change management. So, for example, we know that there are usually dedicated staff to send out reminders, and now we try to gradually roll out the solution over several weeks. So we try to not change everything within a day or a week. we try to roll out the software with pieces. And the usual starting point is reminders to reduce no-shows in the first few days of the rollout.
And how long would you say it normally takes to implement Petal booking?
It's a very good question. It all depends on the size of the clinic. So smaller clinics, between 5 and 10 care providers, usually we roll out within 2 weeks. So the global solution can be rolled out within 2 weeks. For larger clinics that go from 10 to 25, we usually take 4 to 6 weeks to do a complete rollout.
Okay. There's some question, again, sorry, I'm just flying through just for sake of time. There was, I think you already mentioned this during the assessment, if you wanted to clarify that do all appointment slots need to be put online?
Yeah, very good question. So definitely not. You have full control of which type of service and for which physician you want to put appointments online. So it's configurable at the physician level, it's configurable at the service level, and you can set a threshold that says only 10%, 15% needs to be put online. So the goal here is really to give you full control of your processes, internal processes, with the end goal of maximizing the patient engagement.
And the next question is a very practical question. Is it possible for a clinic to block patients?
Yes. It was unfortunately the first instance request we had back in 2015, and yes, you can block patients from using the portal.
Okay. Questions regarding status of an appointment. So can the staff enter the status of the appointment, such as patients are at the clinic or they're meeting the physician? Is that included in your plans?
So the status of the patient in terms of what's the process within the clinic? Sorry, I didn't understand that.
Yeah.
So I've shown some patient statuses that said no show on time. These statuses are all flexible and configurable. So you can change the labels of these buttons, and you get as many as you want. So if you want to say, well, currently with the nurse, currently doing blood tests, yes, you can configure these buttons manually.
Okay. Questions regarding some of the patient experience. So what information does a patient need to be able to book the appointment online? So what sort of things they need to provide to Petal booking?
Good question. So we're using demographics. So we're using their HIN, of course. So they need to put in their HIN, their first, last name, and birthday as well, and their gender. And we do validate that there's a valid record within the EMR.
And can all family members be managed by a single account?
Yes, exactly. So the delegation of relatives is you can add as many relatives as you need to manage all appointments for a family within one account.
Okay. Can you just there's some questions about walk-in appointments. What are some of the options we have in terms of the walk appointments? So can we have patients at the clinic, and we can have non-patients at the clinic, and can you kind of talk about how you would kind of handle that option within Petal booking?
Sure. So we can either enable external patients for walk-in to book appointments, but you can also disable that. And so, yeah, well, the walk-in can be done. So any patient that has a HIN from your province can basically create an account. So that creates a new record if you accept walk-in patients, and that creates a new account in the EMR, and then they can go online and book. You can also say that you reserve appointments of certain time for walk-in patients. And so, for example, you can say that 30% of this service is offered to walk-in patients, while 70% is reserved for roster patients.
Okay, wonderful. Just two more questions here before we wrap up. How many reminders are sent to patients?
Very good question. It's configurable, so you can configure between 1 and 2, and you can define multiple sources. So at the same time, you can say, so when I say 1 and 2, I mean there's what we call the long-term reminder, so the one that goes from 48 hours to a week before the appointment. So that's our long-term reminder, and then there's short-term reminder. So this one is usually configured to be sent out an hour, 2 hours, or 3 hours before the actual appointment. That's our short-term reminder. So these two reminders are sent separately, but they can be sent at the same time by SMS and voice or email.
Okay, and final question, is it possible to send patient forms that can be filled out prior to their appointment?
Yes, I did show a little glimpse of patient form, which was when I went to the physiotherapist section. So we do offer complete a form with questions that guides the type of appointments that will be given out to the patient. There's also forms that can be attached to appointments and reminders for which the patient needs to fill. So the patient will need to fill these forms before the actual appointment.
Okay, so with that, we do want to be respectful of time. I believe that this is going to conclude the webinar for today. I just want to thank everyone for attending and participating and sending your questions in. Francis, thank you very much for hosting this wonderful informative session. Just a reminder that this webinar recording will be available to you shortly. We covered a lot of content today. You might want to revisit, review, rewatch certain parts, listen to more questions. So this will be made available to you to view the recording. If we didn't get a chance to answer your questions today, again, there were plenty coming through the chat. We apologize, but we will be in touch. We have your name written down. We are going to, again, make an effort to answer some of those questions as well. And we can always answer more questions when you call into a telehealth expert. So I hope, Francis, thank you. And I hope everyone enjoyed the session and enjoys the rest of your Wednesday.
Thank you, everyone.
Bye.